What I'm going to talk about today is irregular exercise and vascular dysfunctions. And first of all, this is a fairly graph that most of you are familiar with. It shows major causes of death in the United States. And even if you replace this US with Egypt, it's the same thing here. So what you can see here is death in thousand on the y-axis and major causes of death on the x-axis here. And you can see A in the men and A here in the women. In both cases, cardiovascular disease is the number one cause of death. And if you break down, if you break down the cardiovascular disease, what you can see here, the coronary heart disease, stroke, heart failure, and high blood pressures. And if you group them as which one is a vascular disease or diseases of arteries, this is the kind of graph you get. So interesting thing about this. What we call a cardiovascular disease, and 80% of it is a vascular disease or arterial disease. So disease of arteries. Oh, it's okay. I think this is better because they can see it there too. So what does exercise do on a cardiovascular disease? I think most of you are familiar with this kind of graph. That is, if you increase level of physical activity or cardiovascular fitness, you would reduce cardiovascular mortality. As you can see, many of those 6 different studies showing the same inverse association between the two. But if I ask you, how does physical activity reduce cardiovascular disease? Probably not many of you know. Well, some of you may think because exercise reduces blood pressure, because exercise reduces cholesterol. Well, it's in some extent that's true, which is shown right here. You got blood pressure, you got cholesterol, and body fat. But that's occupy this small space here. Surprisingly enough, 65% of a effect of regular exercise on the cardiovascular disease is unexplained. So we really don't know why exercise is effective. I think the key is that if you look at here, the vascular disease, none of those evaluate vascular function. I think one reason is that many people think that an artery or vasculature is more like a pipe on the left here. But in reality, artery is much more than that. It expands, it constricts, and it is very dynamic structure that you see in your body. So, what kind of function do we need to focus on? Today, because my time is limited, so I decided to focus on these two here. Vascular endothelium functions and the stiffness of arteries. And let me go through each one of them here now. So the first, vascular endothelium. So this is a arterial wall, okay? And this is where blood flows. And you can see very, very thin layer, which is black right there. That is vascular endothelium. And turns out, vascular endothelium releases very strong vasodilators called nitric oxide. And when nitric oxide is produced, vasculature expands and increase blood flow. So what does regular exercise do on the endothelium functions? One way to address is to infuse drug called acetylcholine. When acetylcholine is infused, it binds with cholinergic receptors on the arterial wall, and arteries expand. So when you compare young and older sedentary populations, as you can see here, the increase in the blood flow goes down. That means that with advancing age, your endothelium function are going down. Well, if you look at here, exercise-trained individuals, you can see between young and older subjects, there is no difference. Meaning that by performing regular exercise, you can prevent reduction in endothelium functions. Okay? And another thing we did here is, let's say that we're going to capture sedentary older people put them in exercise training program. Can you increase endothelium functions? And that's exactly what happened here. This is before training, and this is after training. You can see the endothelium function is increased. So the exercise is very effective for both primary and secondary prevention of vascular dysfunction. And when you look at the different way to assess endothelium function, in this case, you can infuse drug called L-NMMA. This blocks a production of nitric oxide. And you can see the similar kind of graph here that I showed you. In the sedentary populations, as you get old, endothelium function is going down. But if you look at exercise-trained populations, there is no age-related reduction. And when we put a sedentary older people into exercise training program, they are capable of increasing endothelium function. So once again, exercise is very effective. I'm going to skip these two slides here, and I'm going to focus on the stiffening of arteries. So because the concept is very complex, so let me explain what the stiffness is all about. So this is a history when your heart is pumping out blood. You can see those large elastic arteries expand during systole, but during diastole, those arteries recoil. So because of this cushioning or buffering functions, when you look at the flows in the arterioles and capillaries, they flow very smoothly and continuously. And that is shown here too. So here's a heart right here, okay? And it goes from arteries and capillaries. And as you can see, in the normal populations, elastic arteries, you can see buffering those cardiac pulsations very effectively. But when you go to a stiff arteries, let's say you get old and your stiffness goes down or goes up and the compliance goes down, you can see those pulsations are transmitted even to peripheral circulations. So that's a problem because peripheral circulation, the capillaries, they do not have protective mechanism to buffer those cardiac pulsations. That's why you get stroke, and that's why you get kidney disease from that. So what does exercise do? Well, once again, this is very similar graph to I showed you. Here's a sedentary populations. Yeah? What I showed you here is arterial stiffness. And then you can see from young to old, your arteries get stiff or hard. But if you look at the exercise training populations, you can see there's very small increase. In fact, if you do statistics, there's no they don't show any increase in arterial stiffness. What about if you capture a sedentary population and put them in exercise training programs? Well, as this graph shows, this is before training, and now I'm showing this as arterial compliance. So directionally speaking, it's completely opposite directions. So after exercise training programs, so arterial compliance goes up. That means arterial stiffness is going down. So you can see the exercise is very effective in reducing arterial stiffness or increasing arterial compliance. And when we did this kind of studies in the women, in this case, it is a post-menopausal women, those older women over the age of 50 years of age who has no menstruations. And what you can see here, before exercise training and after exercise training, they experience enormous increase in arterial compliance, meaning reduction in arterial stiffness. So exercises are a lot more effective in older women compared with older men. So what would be the mechanism underlying the increase in arterial compliance or reduction in arterial compliance? So here's the arterial wall, and here's where the blood flows lumen. And what you can see here is the three layers. The endothelium, I talked about that already. But in the medial layers, it has a two-component elastin that gives you elastic structure of arterial wall, and collagen, which make arteries stiff. Okay. So the idea is maybe that exercise is increasing elastin and reducing collagen. Well, we can do this kind of studies in humans. So what we did is to go to an animal study. So we put a rats in exercise training program and extracted aorta from those rats. And as you can see, similar to humans, in the sedentary populations, young and old, they experienced increased arterial stiffness. But in exercise trained rats, you can see, similar to humans, they didn't show much increase in arterial stiffness. But when you look at elastin content, it's very interesting that if you hear the 319 to 268, it went down quite a bit. But if you look at the exercise trained, I'm going to close this, if you don't mind. Oh, it doesn't close it, never mind. The young in the exercise trained group, what you see here is a lot greater reduction in exercise trained group. So it really didn't make any sense in terms of structural component explaining exercise effect. So what we decided to do is to move from structural component to more functional component here. So in order to address this, what we did is to use microarray technique, because microarray technique, you can analyze so many different gene expressions induced by exercise training programs. And in this case, we also used rats because we have to extract aorta from that. And as you can see, exercise training programs reduce arterial stiffness or increase arterial compliance here. And the interesting thing here is this. Any of the structural components we analyzed, elastin and collagen, they didn't show any differential expressions. But many of the functional elements did show a differential expressions. And we also confirmed this using messenger RNA expressions or protein expressions. So it seems to me that a functional component is the one that's inducing changes in the arterial wall with exercise training programs. So, to address this, we went back to humans. In this study, what we did, we decided to block sympathetic nervous system activity using alpha-adrenergic blockade, phentolamine. And after that, we used L-NMMA that blocks production of nitric oxide, more specifically nitric oxide synthetase. So what we did is to get older women and put them in exercise training programs, as you can see the white here. Okay, before and after exercise training programs, they increased arterial compliance or reduced arterial stiffness. But after the alpha-adrenergic blockade, you can see there's substantial increase in arterial compliance before exercise training programs, but after, there's none. And when you block a nitric oxide synthetase, there's very equivalent reduction in arterial compliance. So what you see here is that alpha-adrenergic system plays a very important role in inducing exercise training effect on arterial stiffness. We also addressed a contribution of endothelin-1. And as you can see, before and after exercise training programs, if you look at a blood concentration of endothelin-1, it goes down with exercise training program. But the blood markers is very rough measure. So what we decided to do is to use, once again, the blockade of endothelin-1. So in this case, they blocks endothelin receptors. These are systemic blockade. And what you can see here, before exercise training programs, arterial compliance increased substantially, okay, with this blockade. But after training programs, arterial compliance stays flat. What does that mean? That means that with exercise training programs, with exercise training programs, the endothelin receptor endothelin-induced vasoconstriction was substantially reduced. So let me go through very quickly. So what about weight training? I thought my session is 20 minutes, not 15. 15 minutes. No, if you look at the program, my session is 20 actually.
I gave you 5 minutes from my talk. I have.
No. Yeah. But I think he misunderstood because if you look at the program, yeah. Anyway, that's why I prepared for. So I was like, whoa. Let me tell you about weight training programs because in these days a lot of people engage in the weight training programs. So what does the effect of weight training on arterial stiffness? Where did it go? So we addressed this question using similar setup here. What you can see here, in a young subject, the weight-trained individuals, they showed very similar arterial compliance or arterial stiffness to sedentary populations. But the interesting thing is this, middle-aged populations, the weight-trained individuals have substantially reduced compliance or increased stiffness. So when you think about what happened to endurance training programs, it's completely opposite to what you showed. So somehow, weight training may be increasing arterial stiffness. Well, but this is a cross-sectional study, so you need to confirm this in an intervention study. So what we did here is put the subject into weight training program that lasts 4 months. And sure enough, arterial compliance was reduced with 4 months of exercise training programs. And another thing we did in this study, if this reduction is caused by endurance training, if you remove that, you should be able to reverse it back to normal. And that's exactly what happens. We put a retraining program that removed resistance training stimuli, and reduction in arterial compliance went up. So that means weight training increased arterial stiffness similar to aging. So that's not really good because weight training needs to be recommended to older people. So what do you need to do? The key appears to be that you need to combine both weight training and endurance training at the same time. So this is very similar graph that I just showed you that shows control group in the red and the weight training group in the yellow. And as you can see, if you perform both weight training and endurance training programs, those reduction in arterial compliance didn't happen. Actually, there is some increase in arterial compliance with a combination training programs. So it seems to me the habitual aerobic exercise and the resistance exercise have a completely different effect on arterial stiffness, but when it comes to endothelium functions, aerobic exercise is beneficial, but weight training doesn't do as much. That's all I have. Thank you very much.